A 28-year-old woman is found to have a single amino acid substitution, glutamine for arginine, near the protein C cleavage site in her coagulation factor 5 gene product. The patient is at greatest risk for developing which of the following conditions? Now, if we have a mutation in the cleavage site of factor 5, then that can result in a hypercoagulable state. Now, in this picture, I have factor 5 drawn in, and factor 5 is normally going to have these cleavage sites where protein C and S can bind to and deactivate factor 5. Now, if you have a mutation that causes the absence of these cleavage sites, then protein C and S will not be able to bind to factor 5 to deactivate it. And so, if they're not able to deactivate factor 5, then that is going to cause a hypercoagulable state within the body. And so, that can ultimately result in formation of clots that can result in deep vein thrombosis, and if that travels to the lungs, that can result in pulmonary embolism. And if those clots travel to our brain, then that can cause cerebral vein thrombosis. Now, patients with factor V Leiden also present with recurrent miscarriages. And the way you can think about this is, so here's the mom and here's the fetus, and normally the mom is going to send oxygenated blood to the fetus through the placenta. Now, if we have a hypercoagulable state, we can have formation of clots within the vessels of the placenta. And so now we're not able to send oxygenated blood to the fetus, resulting in death of the fetus. And so this is why patients with factor V Leiden have recurrent miscarriages. Now, if you're not able to deactivate factor 5, then that is going to cause increased production of thrombin, because remember, factor 5 is going to play an important role in converting prothrombin to thrombin, and so that is going to result in a hypercoagulable state. Now, this information can be found on page 433 of First Aid. Remember, the three complications that is going to be common in patients with factor V Leiden is going to be DVT, cerebral vein thrombosis, and recurrent pregnancy loss. If the DVT goes untreated, it can go to the lungs to cause pulmonary thromboembolism. So the correct answer is going to be answer choice E.